What is going on, everyone? This is your daily dose of mental health, and in this video we will be discussing the 5 signs of escalation for a fight. And this is in regards to inpatient psych facility. As you know, I am a psych nurse, and I'm going to be starting a new playlist called the 5 signs, so be on the lookout. It'll be the playlist is going to be the 5 signs. In this video today, we're going to be specifically discussing the 5 signs of escalation between patients, or of a patient, signs to look for if they're going to go, if they're about ready to go off, explode, things of that nature. Also, other kind of videos that I'm going to put in this are going to be in the 5 signs playlist are going to be videos kind of like what I'm thinking right now is 5 signs that psych nursing, or for PCAs, 5 signs knowing psych nursing and inpatient is for you. 5 signs you work for a good organization or hospital, profit or non-profit, because that does make a huge difference. 5 signs you're working 5 signs you're working in a more dangerous situation, and that could be in regards to does your inpatient psych facility have security or safety coordinators? Nowadays, for the one I work for right now, for example, we take involuntary patients, and there are no, they don't have safety coordinators or security. However, we do have PCAs and techs, and they're the ones who have to, if we have to put a patient in a hold, the only kind of hold they do now is we do physical holds. There's no mechanical, no 4-point restraints. That's not a thing in this organization. Another thing, one of a 5 signs video I'm going to do is 5 signs in regards to a patient is hiding something. 5 signs a patient, for example, they're typically, if a patient, for example, comes from jail or whatnot because they're suicidal, there's going to be things you're going to have to look out for. Do they, most of them when they're in jail carry shanks, things like that. So what are the 5 signs is the main topic of discussion for this playlist. And in today, as I said, in this first video, it's going to be and this is me personally, the 5 signs that a patient is starting to escalate or be aggressive in the inpatient psych facility. And we'll get right on into it. Before I get any further, please like and subscribe to the content. There's the subscribe button right down here in this right-hand corner. This playlist will be, as I said again, the five signs in regards to psych. Staff, violence, you name it, we're going to be doing it. I think this is going to be a really good playlist for a lot of different people. So as I said, let's get it going. This is your daily dose of mental health. Check out all my other content, my whole story of addiction and recovery. I've got all sorts of videos, why I got into psych. But this is the 5 signs. Now let's get right on into it. Okay, so as I said, I work in an inpatient psych facility. I've worked in one for over about five and a half years now. I've worked as an RN in just strictly psych. I've worked with patients who come from jails, who come from jail, who are suicidal. I've worked with a lot of people, women who are dumped off by pimps off the street because they're not making money anymore, prostitutes. Prostitution is big today, and there's many reasons why I am in favor actually of just making it a legal activity, because it would cut down, in my opinion, on the amount of violence that comes with it, which you would be surprised what you see. So yes, I do have experience, especially with this first one. So the 5 signs of escalation, from a personal experience level, and what you should look out for if you work in an inpatient psych facility, and in any inpatient, what you should look for, but especially in those high acuity settings. Number 1 in those 5 signs that a patient is escalating: pacing. Now, let me real quick get into this. If a patient is pacing back and forth, before you make the assumption that they are escalating and, you think something's building up, make sure it's not just make sure it's not, just that they're pacing in order to calm themselves down, because a lot of times people who have schizophrenia or hear voices, That's one thing they commonly do that helps them deal with their voices. A lot of people with schizophrenia, they're actively moving and pacing back and forth. Actively. But outside of like schizophrenia, if you see a patient start to they're pacing, you can see it in their face getting red, they're putting their hands up here behind their head, they're really, starting to not even yell, but you can tell there's a vibe to it. There's a vibe to it. A lot of times when I see that, I typically will tell one of the PCAs or something, hey, let's make sure we're clearing the patients that, if they're not in their, if they're in their rooms, fine. But if they're, for example, out in the milieu, let's kind of give them some space because we know something's going on. That's how I deal with it. And then typically, depending on the situation, if I feel I can go up and it's appropriate, I might go up and start pacing with the patient and just having a general conversation with them. Hey, what's bothering you? What's going on? I'm not going to go up to him and say, are you freaking out? Like if you go about it that way, it's not going to help. You got to have a general conversation with them. And 9 times out of 10 with these patients, like if it's one of my patients and they're going off on them, when I do my morning assessment, I typically establish a pretty good rapport with them to where I can just have a conversation. Okay, most of the time it's over something like, oh, I didn't get my cigarette break, something like that. So general communication, making sure all the other patients are safe, that's number 1. So watch for the pacing. Number 2, door slamming. Door slamming and screaming. I know this seems fairly obvious, but a lot of times I've seen it where a patient is screaming or somebody slamming doors, and you'd be surprised how much the staff just ignores it. I've done it too, where you're just like, this patient, this is how they act, this is what they do. But a lot of times when they're slamming doors, they're acting out in regards to they're wanting one of us to come up and they're wanting attention and wanting to let us know something. And what I mean by this is here's an example. Patient slamming their door, trying to get the staff's attention because they were wanting to tell us that another patient was wanting to attack them because they got in an altercation on the night shift. And that none of the staff was listening. So in order to get attention, they were, causing attention on themselves by slamming doors, saying this patient is going to hurt me at this time today. Very important. So watch out for door slamming. And once again, what I'm telling you, this goes out to all psych nurses, techs, PCAs, anyone who works in psych and inpatient. Really, these 5 signs, take them to heart. Number 3. And this is a big one, and the reason why I put this on here, it's because if you work in inpatient psych, you're going to get patients that come from prison who are suicidal. They'll typically be involuntary on a 72-hour or 96-hour hold. And this third one is toward typically people who are from jail, or this can be patients as well, is if they know they can't have shoelaces, and typically, they're wearing their flip-flops, but if they're wearing their flip-flops and they come up to you and ask you, hey, can I wear my shoes? Can I wear my boots? Because a lot of times boots don't have, for example, they want to have shoelaces and they don't need them. And you might go, why? Okay, yeah, I'll give them to them. Why does that matter? Typically, what I have seen indicates is if a patient is wanting their boots randomly, and there's somebody who for the past 3 or 4 days has been wearing their flip-flops, been doing that, and they want their boots, that means something's going to go down. Not saying it always will, but there's a very high chance that there's something going on. So before you hand them those boots, if your facility allows it, some don't allow it. Mine, we can give them their boots as long as there's no laces in it. But if you give them their boots, before you do it, I would make sure and ask patients, and not just in general, hey, is everything going okay? Because you just don't know. And even if the patients are saying, nah, there's nothing going on, it's all good, I still would be very cautious about it. I'm going to be asking the patient, why do you need your boots all of a sudden? Something like that I will be direct with, because I've seen this was a couple of years ago, a patient, hey, can I wear my boots? Okay, and this was at another facility I worked at. That allowed him as well. Didn't have shoelaces, give them to him. He's been cool the past couple of days. He hears voices, and you give him the boots, he's cool, and then at lunch when they go down, he just starts wailing on this kid, and I mean, hits him to the ground and starts kicking him, smashing his head in, and it was brutal. So that's why I tell you, if a patient is asking for boots or even shoes, closed-toed shoes, without lace, at any psych facility, they're not going to give you laces. That patients can kill themselves with laces, especially in a psych facility. And even if they aren't suicidal, they can give them to somebody who is suicidal. Or if they're homicidal, they can kill someone with them. So laces will always be a no-no, but watch the shoes. Number 4, Does the patient, and I always tell people this, like when I go in the beginning of my shift, let's say, so I work tomorrow, for example, Monday, I'll have a whole new list of patients. The first thing when I'm getting my report, I'm getting reported, oh, this patient has this, and this going on. What I always ask is, do any of these patients have a history of violence? Which ones are the violent ones that you've noticed or you've had problems with up to this point? And the reason why I ask that, it's because if you know offhand who are potentially the ones who could cause problems for you, it'll make it a lot easier because you can talk to them, ask about their problems more during their morning assessments. If you're a PCA, spend a little bit more time with them, see what's going on, because you'd be surprised if you just talk to the patients. A lot of them just want someone to talk to, especially ones who are from jail. If you just treat them like a normal human, which we should, and establish a good rapport, you'd be surprised how many problems could be avoided. So know their history. If they're from jail and they have we've gotten patients before that have been were incarcerated, killed a couple people, and they let them come to the psych facility because they were suicidal. They tried to kill themselves. In that situation, you got to be very careful. And I'm not saying they're going to hurt people at the psych facility if they're transferred there, but you just have to know their history. And number 5, are other patients coming up to you and reporting, hey, this patient is starting to escalate. This patient is scaring me, worrying me. If there are patients, even if one, but if there's multiple coming up to you saying that, you should investigate it, because sometimes there can be one patient who is hearing voices themselves saying, oh, this patient is going to come and, is threatening me, when in reality that's not happening. But you will, if there is multiple patients coming up saying stuff, investigate it, tell the PCAs to be on alert, let your manager know this, let your manager know what's going on, let your house supervisor know. If there's charge nurses, let them know. Because the more you tell them before the situation happens, if something does serious happen, they're not going to come back and investigate you for what, you're not reporting. You should always report everything that's going on. Lastly, and this goes to everyone, working in psych, you will feel the vibe if someone is escalating. I'm telling you, you'll know internally, you'll be able to tell if somebody's escalating, if somebody's about ready to go off. So my big take to you is, if you feel like somebody's going to go off, you feel that, alert your staff if you can, take a deep breath. If you can, talk to the patient. If you can't, get to a staff member who can and let the staff know if you got to call a code or whatnot, so you can get the situation taken care of instead of letting it go another 10 to 15 minutes and then, all hell breaks loose. So yeah, those are the 5 signs. As I said, pacing, door slamming, or just wanting attention seeking, asking for their shoes, huge one, history of violence, and if there's other patients reporting that someone is, acting a certain way, aggressive, suspicious, paranoid, acting like they're going to hurt someone, and your own intuition. Remember, I'm going to be doing this new playlist. This is the first video of it, called The 5 Signs. In regards to psych facilities, not just specifically psych nursing, but what it's like working in psych, how it can relate as well to jail. You'd be surprised in inpatient psych facilities. I'm not talking outpatient, inpatient. How many, when somebody's suicidal, if they're in county, or county jail or whatnot, typically won't get any from a penitentiary or whatever. But you'd be surprised when you get somebody from jail how smart. And that's the thing, how smart they are, what they can do. So I'm going to be doing a lot of videos called The 5 Signs, weapons to look out for, how to search a patient's room during your 15-minute rounds, stuff like that. I'm going to try to keep these videos right around 15 minutes. I'm right at the 14-ish now, but this is your daily dose of mental health. Have a good week, everyone, and let's get this going. This will be called The 5 Signs. I love y'all.